Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. Today we're going to learn about strokes, what they are, how to notice someone who may be having one, and what to do about it, and how to best try to prevent you or your loved one from having a stroke. Our guest today is Dr. Richard Jung, the Associate Director of Neuro-endo vascular surgery at South Shore University Hospital and Director of Stroke at Northwell Health, Eastern Region, as well as an Assistant Professor of Neurology at Zucker School of Medicine at Hofstra Northwell. Dr. Jung, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you very much for having me on, and it's an honor to be able to speak today.
Tell me first, before we get started, more about you. What made you focus your career on strokes, or at least a part of it, and neuro-endo vascular surgery?
Interestingly, when I was deciding to even become a doctor, I actually just wanted to be a pediatrician. And so halfway through medical school, I thought I was just going to do general pediatrics.
Okay.
And I did neurosciences in my undergraduate years. So I had a lot of interest in neuro. And the interest kind of evolved into maybe pediatric neurology. And then I did my rotations through neurology in medical school, and I saw a lot of patients with stroke. And that's what really sparked the interest for neurology and adult neurology. And then after that, I really decided that, stroke neurology was the way to go. And then I got to my training in Cleveland in Case Western, and then I saw something really incredible things happen in terms of treating stroke from a procedural standpoint, where procedures called mechanical thrombectomy or intra-arterial thrombolysis was being performed at Case Western. And so we can get a little bit more into that later, but that's what really sparked my interest in stroke therapy.
And there you stayed, right?
I did for a long time.
Okay.
In Cleveland, I was there for, a good 6 years of my training. So I did all of my neurology, my vascular neurology, and neurointerventional radiology training there. My first job was actually in rural Missouri, which was interesting, for 4 years in Springfield, Missouri, at Cox Health, and then 5 years in Baltimore. After that, in the Sinai Health System, the LifeBridge Health System with Sinai Hospital, Baltimore. And then most recently, 2 years ago, we moved to Long Island, and I've joined Northwell since then.
Awesome. So what is a stroke? Can you start with that, just the basic anatomy?
Yes, absolutely. Mm-hmm. Yeah, stroke is damage to a part of the brain that occurs because an artery that is feeding that part of the brain got blocked by whatever, either a clot, usually it's a clot, that blocks an artery that goes to that part of the brain. So that part of the brain cannot get the oxygen and blood that it needs, and then subsequently gets injured and then dies and causes a manifestation, depending on where it is in the brain, of a deficit or a problem. But that's what a stroke actually is, ischemic stroke.
So depending upon the area in the brain will manifest in terms of the effects in the body.
That's right. So, there's sometimes you can injure the language portion of the brain and you have difficulty speaking or understanding or controlling one side of the body, that kind of thing.
What are some of the causes or the risk factors that can predispose to patients or people to having a stroke?
The number one risk factor for having a stroke in a lifetime is, unfortunately, something we can't do anything about, and that is age. So advanced age is the number one risk factor. Older people tend to have strokes as opposed to young people. That being said, we see a handful of young people every year who have strokes. They're very unusual.
Yeah.
Other typical risk factors include uncontrolled high blood pressure or hypertension, diabetes, which is a problem with your blood glucose control, high cholesterol, smoking, illicit drugs, chronic alcoholism, and a wide body girth, a high body mass index, and sedentary activity as opposed to regular exercise. So those are the typical risk factors for stroke. And one more, very important, is obstructive sleep apnea. So that is another one.
So there's different types of strokes. Can you tell us the different types of strokes that you see?
That's right, there are. And the most common type of stroke that there is something called ischemic stroke. And that is the type that we're talking about today, which is the blood vessel blocking kind. Now, the other type of stroke is called hemorrhagic stroke, where a blood vessel in the brain bursts and causes bleeding in the brain. And a subset of that is aneurysmal subarachnoid hemorrhage, where a brain aneurysm ruptures and causes damage to the brain because of the high pressure that's caused by aneurysm rupture. And so in the grand scheme of things, ischemic stroke, it encompasses about 87% of stroke, intracerebral hemorrhage about 10%, and aneurysmal subarachnoid hemorrhage about 3%. And there are about 800 strokes a year on average.
So there are some things that we can change and some things that we just cannot change. Do you still call them modifiable and non-modifiable risk factors? Certainly.
There are things that we can change, and things like blood pressure, we can take medicines and be compliant with our medicines and follow up with our doctors to make sure that our blood pressure is nice and well controlled. We can control what we eat. We can control how much exercise we do per week. We can control we can try to control how our body habitus is by not overindulging and not being too sedentary in our lifestyle. So those things are things that we can control. We can, to some extent, control diabetes by watching what we eat and exercising and taking medicines. And same with our cholesterol intake. And everyone can control smoking, even though they feel like they cannot. It is not a necessary nutrient to the body. And smoking and alcohol, yes, they are vices, and they can be very addictive, and people can become dependent on the nicotine and the alcohol. But those are things that we can control. It can be not easy, but it's something we can modify.
So when you talk about smoking and you're talking about hypertension, all of these different risk factors, how do they cause, you talked about an ischemic event or the lack of perfusion or blood flow to the brain? What is happening there?
So usually the number one risk factor after age is hypertension. Chronic hypertension can cause disease of the blood vessels at the big level, the big arteries, the medium arteries, or even at the microscopic level. And a lot of the times, hypertension can make the ends of these tiny arteries very diseased, where you reach a threshold at some point and they clot off. Mm-hmm. Hypertension and smoking and diabetes and cholesterol can also lead to hardening of the arteries, the large vessels like the carotid arteries in your neck, the ones that you feel a big pulse, the one that everybody's checking for a pulse to see if you're still alive. Those are the carotid arteries, and they go straight to your brain. And some people can develop a lot of plaque and hardening of the arteries in those areas because of long-standing uncontrolled high blood pressure, smoking, diabetes, cholesterol. And sometimes there's a little genetic factor there too, because not everybody who has all these things develop plaque in their carotid arteries or within the arteries in their brain. But certainly the people who are susceptible to that, the disease is much more serious. That's typically how these typical risk factors will lead to vessel and compromise in their vessel integrity and put you at higher risk of clotting. And so if somebody has a significant amount of plaque in, let's say, the carotid artery in the neck, that plaque can crack, what we call plaque rupture, and a local clot can form at the plaque, and that clot can then travel from the artery in the neck and lodge itself into one of the arteries in the brain, causing a stroke. And so very important to to stay pretty healthy, to try to prevent significant carotid disease.
Yes. You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about strokes and stroke prevention. My guest today is Dr. Richard Jung, the Associate Director of Neuro-endo Vascular Surgery at South Shore University Hospital and Director of Stroke at Northwell Health Eastern Region, as well as an Assistant Professor of Neurology at the Zucker School of Medicine at Hofstra Northwell. So, Dr. Jung, give us a little bit of the warning signs that will really tell or can give us a hint that something's going awry. This patient probably is having a stroke.
So we typically use a mnemonic called FAST, which is F-A-S-T, right? F is face, arm, speech, and time. And we've used this mnemonic for many years, but now we've expanded it to include a few other symptoms. So now the main mnemonic that we use to remember signs and symptoms of stroke is B-FAST, B-E-F-A-S-T. So let's go over the letters. B is for balance. So if there's a sudden change in your balance where you cannot walk, where it's significantly disabling, that could be a sign of symptom of stroke. E is for eyes, basically your vision. If you have complete loss of vision in one eye, or half the vision in both of your eyes, or double vision, those are all potential signs and symptoms of stroke. F is for face. If half of your face is drooping and looks asymmetric, and that's new and happening right away, then definitely try to get to the hospital right away, because that could be a stroke as well. A is for arm. That can get weak. So if you have sudden onset or change of the use of your arm, a clumsy hand, or an arm that feels like you can't control it, or it's dragging, or it's limp, that could be a sign as well. S is for speech, where if you have slurring of speech or difficulty producing words, or difficulty understanding somebody, it's a problem with your language, that could be a sign as well. And then T is for time. And time is very, very important, because you have a very limited window of period of time to try to get a potentially life-saving medication, an IV medicine, for somebody who has an acute ischemic stroke. So that medicine is called tenecteplase or alteplase. There are two different ones, and tenecteplase is a newer medication that we're using nowadays. But what it does is it breaks up the clot that's in the brain to try to minimize the damage, or try to completely reverse the effects of the stroke that's happening.
So is this give rise to the necessity and urgency for seeking immediate medical attention when you're having this B-FAST, these symptoms, or whether it's B1 a symptom or 3? Is it very important that you immediately call 911, or is this something you just make an appointment to see your physician and just take it, as it, this is something that I'm experiencing? How emergent is this that we should respond to these symptoms?
So if there's a sudden change with any of these symptoms that are disabling, then it is absolutely imperative that you get to the hospital as soon as possible, because you have a very short window period of time to receive this potentially life-saving or life-changing medication for stroke. It is the only approved medication in the United States and in the world that we have to try to combat the effects of stroke. Stroke can be very, very devastating. It can be very disabling. It can also kill people. So you can die from a stroke if it's bad. And if you miss this window, this short window, which is only a few hours, then there may not be anything else we can do to try to change that destiny. So if you're having disabling symptoms and they are significant and they happen like that, like suddenly, then 911, get to the hospital, don't play around. Now, if your symptoms are very mild and not disabling, then the risk of getting the blood clot busting medication might not be worth getting, because the stroke symptoms are very mild. But we sort that out at the hospital. What's mild and what's disabling. So if you're scared and something new, weird is happening like that, just get to the hospital. We sort it out at the hospital.
So it's not according to you to make that determination as to how severe it is when you're experiencing this. It's good to, you'd rather side on safety than to stay home and kind of try to figure it out yourself.
Absolutely.
So let's get back to what you were saying about, the predisposing factors. How does diet play a factor in this, in terms of, you talked about the cholesterol and you talked about, the hypertension. Talk to me about that. What do you suggest for, the role of cholesterol and so forth?
And so diet is very important in regards to general health, so cardiovascular health and brain health, and just vascular health in general. Because what we consume, the amount of sugar, the amount of salt, the amount of fats that we intake, every body is different in terms of like how we metabolize those things. Patients who have diabetes, they have a difficulty processing sugars, and sugars are not just from sweets. They are from carbohydrates that become sugars that get elevated in the blood because their bodies cannot regulate that sugar, cannot get that sugar level down in their systems. So diabetics have to take a very specific, sugar control, carb control diet to try to limit the amount of sugar that's elevated in their blood. In regards to cholesterol, animal fats and LDL is the bad cholesterol that we really try to keep low. In a normal person, we want them to be less than 100. But if they've had a stroke or stroke warning or heart disease, then we target a lower level of the bad fats, the LDL, and a level less than 70, or even extreme less than 55, is what's recommended for patients who are at high risk for having another stroke or cardiovascular disease. And cholesterol comes from many places. Can come from some animal, mostly animals, but then plants you can also create fats from oils, obviously like coconuts and avocados and olive oil and those kinds of things. But in terms of a particular diet to stick with for prevention of vascular disease, they have studied something called the Mediterranean diet. And they studied the Mediterranean diet because it seemed that in the Mediterranean area, they had the least amount of cardiovascular disease. And they were thinking, well, what are they eating to try to prevent a lot of vascular disease? And so that diet includes a lot of fresh vegetables, fruits, fish, nuts, those kinds of things. And not a lot of, not a lot of processed meats. Not a lot of fried foods.
All the stuff we love.
All the things that we just adore.
Yes.
All the things that we just have to say yes to on our birthday.
I know. Oh, no. I know.
And keeping a diet like that can really prevent over the long run, because it's not going to be something that you immediately fix. There's over years and years and years that you will develop, people will develop plaque or diseased arteries. So, keeping a healthy lifestyle is super important.
So outside of medication that you say you administer to patients, I guess, that have a clot formation and this clot busting kinds of medication, what other kinds of surgical, is there like a mechanical, something that you could do to remove clots?
Yes, absolutely. When I was going through all of my training, this kind of therapy where we physically remove a big clot from the brain was investigational. And but now it is the mainstay of treatment. And so if you have a big clot in blocking a major artery in the brain, causing major symptoms, that's going to result in a major stroke, and you come quickly within a certain amount of time, then to a comprehensive or a thrombectomy capable center, then we can do emergency minimally invasive surgeries where we snake a catheter, the long thin tube, from the artery in the leg or artery in the arm, and snake that all the way up to the artery in the brain. We're right at the site of the clot. And either we physically suck it out with a special vacuum, or we take a small little retrievable stent, like a metal stent device that gets deployed across the clot, and then physically removed that way from the inside. And this therapy has been very well studied and shown significant benefit for patients who are suffering the worst kind of stroke.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about strokes and stroke prevention. My guest today is Dr. Richard Jung, Associate Director of Neuro-endo Vascular Surgery at South Shore University Hospital and Director of Stroke at Northwell Health Eastern Region, as well as an Assistant Professor of Neurology at the Zucker School of Medicine at Hofstra Northwell. So if I'm having a stroke and possibly, unfortunately, do not get to the hospital early enough, could there be some residuals or some long-term effects, and what might they be?
If you're having a stroke, let's say somebody just woke up with a stroke and we don't know, the last time that they were totally normal was like the night before. Usually that kind of excludes them from getting the IV clot busting medicine. But if special imaging is done and shows that there's part of the brain that's still viable, and there's a major blockage, then you may still be eligible for emergency treatment. And so there is still hope for people, even within 24 hours. Good. Of last known well. We go by the last known well, and the clock will start ticking for major big blockages, and that we have to sort out with very special imaging and conversations with the patient's family and everyone else that's available to provide medical history to decide whether to undergo this whether they are a candidate for the procedure and whether to undergo that procedure or not. So there is some hope for people who we miss out of the window. Now, let's say you're not a candidate for any of those things and you're having a stroke. Sometimes it depends on how major or mild the symptoms are. If you're having a mild stroke with a good amount of rehab and time, and if you're healthy and you have good family support to help you get to the rehab appointments, a lot of times people can turn around pretty well. There are patients who have had, and the minor strokes tend to turn around very, very well and almost get back to normal. Mm-hmm. The moderate strokes, it really depends on how disabling it is for them. Some people I know a young woman who had a brain hemorrhage, which is a type of stroke, and she had lost the use of her left arm, but she could do everything else. She could still drive, take care of her kids, and still go to work. and it was pretty amazing, the turnaround that she made.
Well, neurologically, I'm sorry. Mm-hmm. Go ahead. I was amazed by that, because neurologically, how does the brain adapt and rebound that way? It's so residual.
That's right.
So resilient, I would say.
Right.
That it can bounce
because
back.
the brain is plastic, and there is plasticity. Plasticity means that it can change. Even though the brain cells that are damaged don't grow back, the existing brain cells that are still around that area can make new connections by just biofeedback. When you do an activity enough, it strengthens those connections. Now, her arm isn't normal, but she's kind of starting to be able to use that arm to at least hold something while she uses her good arm to do a sophisticated movement, like hold her phone, right? Mm-hmm. She's now able to hold her phone in the hand. With a good hand can type. And so even though she can't type with that hand, she's getting back to using it to some certain extent. Mm. And so there is a good amount of recovery that some people can have. Some patients come in and they can't speak at all, and they're totally paralyzed on one side of the body. And I've seen them come back into the clinic, and over the next year or so, some people are talking again. Some people are walking on their own again, even if it's with a cane or a walker. And some people can make some pretty significant recoveries. It all depends on how much brain is damaged and how young they are, how much brain cells they have left, and what support structure very importantly, what support structure that they have to get to the rehab appointments and get the early rehab and stay healthy and keep up with the medical appointments.
So how important is rehab? I'm thinking, speech, occupational therapy, physical therapy, all this rehab. How important and significant is that for recovery?
It is absolutely important. I've had very few patients rehabilitate themselves because they had a very bad financial situation, no medical coverage, no Medicare. This is out in the middle of Missouri. New York, you have emergency Medicaid, which is pretty good, but Missouri was lacking in resources. I remember a patient, he just went to the farm and rehabilitated himself. Just exercised every day and did it on his own. But he did it early and every day and continued with it. And so he was able to regain his ability to walk, drive, and do his thing.
Yeah, that's amazing.
And so amazing some people can do. Yeah. But then not everyone has that drive.
Yeah.
Not everyone. Right. There's some people who are more disabled who can't do that. And so they need help doing the rehab. And so early inpatient rehabilitation for patients who are quite disabled has been shown to significantly improve their downstream rehab potential. So within the first 3 to 6 months after a stroke is probably the most rapid amount of recovery. And doing intensive rehab during that time is super important to get them the best, to land the best, that they can be 6 months to 1 year down the road.
So where can we find information about you?
Me? Yeah. Oh, I'm nowhere online. Well, I have a LinkedIn profile. Okay. You can find me there. Okay. On South Shore University Hospital's website, you can, or in Northwell's health system, you can find a doc. You can just type in my name and find me there. There's a little bio on there. But yeah, those are probably the two easiest places to search for information.
Well, Dr. Richard Jung, right?
Yes.
So, Doctor, if there was one word or two words that you can leave us with when it comes down to stroke, what would you say?
I would say be fast. Okay.
Be fast.
Don't sit on your butt and wait for this to go away tomorrow. Tomorrow may be too late.
Thank you so much. That's awesome.
That is the mantra.
Yes. Thank you so much for being here, Dr. Richard Jung, the Associate Director of Neuro-endo Vascular Surgery at South Shore University Hospital and Director of Stroke at Northwell Health's Eastern Region, as well as an Associate Professor of Neurology at the Zucker School of Medicine at Hofstra Northwell. We thank you so much for giving us this important information, and we hope you continue to stay healthy and keep doing the great work that you're doing.
Thank you so much for having me on board. It was an absolute pleasure to speak with you all and to help provide education to the community. Thank you again.
Likewise. This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.